Banks are busier than ever these days, and some are working to expand their menus.
Channel 3's Melissa Cooney joins us live in Essex with why volunteers are trying to add more options.
Good morning, Alexandra and Alyssa. Well, it's hard enough to put food on the table for some folks, and adding dietary restrictions can make the food shelves even more bare. That's why some places like Aunt Dot's here in Essex are working with the community to make sure everyone's needs are met.
There was a little bit of a discrepancy between households that did not have any kind of dietary restriction in terms of how much food that they were able to take home because of that, and those that didn't.
Aunt Dot's Place is a food shelf in Essex that started their dietary and cultural dietary needs section a year ago. Amy Bourdreau says they stock their food by gathering information from their clients. She says the most common requests are low sodium and low sugar foods, especially for clients with diabetes or heart disease. Other popular requests, gluten-free for celiac clients and foods without eggs or dairy for those with allergies.
Once you start asking and intentionally asking clients what their needs are, you learn more. So we have been able to expand the area to reach more of our clients that have those needs.
In June, Aunt Dot's Place had 215 visits, and 51 of them were clients with special dietary needs.
We're continually working to expand our inventory to include, for example, more culturally relevant and dietary specific foods to meet the diverse needs of this community.
Feeding Chittenden too has expanded inventory when able, agreeing that gluten-free food is a popular request. Associate Director Anna McMahon adds they partner with UVM Medical Center and the Children's Hospital for food insecure patients who can make their dietary restrictions clear on an online marketplace. But in a post-flooding Vermont, McMahon notes there is scarcity in the food bank world.
A lot of the produce that we would normally be receiving from the Intervale and Diggers Mirth, we're going to be seeing a lot less of that. But we're constantly working to expand our food inventory so that we are asking recipients and guests, what are the kinds of foods that you need?
Dietary restrictions are often affiliated with health concerns. The Community Health Center in Rutland has a wide range of patients, some of which experience social determinants that create barriers for health care.
Economics plays a big role in whether they can afford their medications, whether they can afford their food or their living situation.
For years, the center has had a care manager program to support patients, noting many need extra support now more than ever. Their pharmacy program helps food insecure patients receive fresh produce and distributes gas cards to help in transportation. They also have a registered dietitian and a diabetes support group.
Once patients go out and get food, you don't have a lot of control about what they eat, but we do have resources available.
And the state confirms that people with allergies on Medicaid do have their epinephrine covered. Live in Essex, Melissa Cooney, Channel 3 This Morning.
Thank you, Melissa.